My name is Leanne Sherrod. I'm a speech-language pathologist and the President and Chief Clinical Officer here at Expressible. Thank you for joining me to learn all about apraxia of speech and how you can support someone who has this condition. There are two different types of apraxia. One is called childhood apraxia of speech, commonly referred to as CAS. This is a disorder that's present from birth. The other type, acquired apraxia of speech, happens later in life because of a medical event. Let's take a closer look at the two types of apraxia and what causes them, along with some common misconceptions about the condition. While research can't yet point to an exact cause of childhood apraxia of speech, in many cases genetics are involved. Approximately 1/3 of children with CAS have some kind of genetic component linked to it. This means they may have a primary genetic diagnosis, such as Fragile X syndrome, Down syndrome, or Klinefelter syndrome, and apraxia is a secondary characteristic of that diagnosis. But keep in mind that this doesn't mean their primary diagnosis is the cause of apraxia. The two can simply be related. While most often childhood apraxia is present from birth, research shows that it can also be linked to a neurological event following birth, such as an infection, injury, or seizures. It can be difficult to determine the exact cause because apraxia doesn't present until later when speech begins to develop. The cause of CAS can also be idiopathic. That simply means the cause is unknown. It can be difficult for parents and caregivers to receive a diagnosis with no known cause. But caregivers shouldn't worry that they somehow caused the disorder. There is no current information suggesting that anything a caregiver does or doesn't do, such as a lack of talking to or reading to your child, that would cause this specific motor issue. Now let's turn to acquired apraxia of speech. This is the result of some type of damage to the brain, such as a stroke, head injury, tumor, surgical trauma, or a progressive disease. In these cases, the person's speech was likely typical before this medical event. You can see why this adds an extra layer of frustration for the person with apraxia. To have the ability to communicate and then have it taken away is an incredibly hard thing to go through. There are a few common misconceptions about apraxia. The first is that a child will outgrow apraxia of speech on their own. This is unlikely, and as a result, formal speech intervention is needed. The earlier a person can begin speech therapy treatment, the better the chance of a positive outcome. Another misconception is that because people with apraxia can't express themselves clearly with speech, they must not be able to understand what others are saying to them. While a person with apraxia could also have a receptive language disorder, which would affect their comprehension, many people with apraxia struggle only with the output of speech. You should talk and engage with them just like you would with anyone else. Many people recognize verbal communication as the only way to communicate. While this is the most common form, it's not the only one. People with severe apraxia of speech may use something called augmentative and alternative communication, or AAC. This involves using other methods of communication besides speech, such as pictures, symbols, or an iPad or speech-generating device. Many people with apraxia successfully use an AAC system to get their needs, wants, and thoughts across to others. A speech therapist can help them determine what type of system or device may be best to use. Before we wrap up today, let's take a minute to recap what we've covered in this video. Apraxia that's present from birth is referred to as childhood apraxia of speech. Apraxia that develops later on due to a medical event is called acquired apraxia of speech. Just because someone with apraxia can't speak clearly doesn't mean that they don't understand what's spoken to them. People with apraxia need speech intervention in order to improve their communication. They won't outgrow the condition on their own. Finally, there are alternatives to verbal speech that a person with apraxia may choose to use for successful communication.